Good afternoon, everyone. Welcome. Many thanks for accepting our invitation. My name is Ettore Greco. I am the Executive Vice President of the International Affairs Institute. We can start the registration. I'm very glad to open this meeting, whose subject is advancing the global health agenda, the challenge of malaria elimination. This meeting is part of a project we at the I have conducted in the last few months in cooperation with the support of the Friends of the Global Fund Europe. You know this organization, in any case, is an independent organization whose mission is to raise public awareness and also mobilize public and also political support for the Global Fund for the fight against pandemics, specifically HIV and AIDS, tuberculosis, and malaria. I would say the overall goal of the project is to examine the state of play of the fight against malaria and the new challenges that it is increasingly facing, including in particular the impact of global change and antimicrobial resistance. We have tried to study malaria also from a broader perspective, as telling an important case studies of more general global health issues, such as the nexus between climate change and health, pandemic preparedness and response, and the role of technological innovation. We have also tried to address the malaria issue in relation to the changing global health architecture and governance, the emergence of new actors in the field of pandemic, and the evolving role of existing global health partnerships. I should also add that the central component of the projects relates to the role of G7 under the Italian presidency this year in supporting the fight against malaria as part of the group's wider agenda to ensure universal health coverage. We have also drafted a policy paper which has been just published on our website, is now available, and which will be briefly presented in this meeting by my colleague Francesca Maremonti. Our paper illustrates the latest developments in the fight against malaria, and on the basis of this analysis provides at the end some concluding remarks and especially a set of recommendations for the G7 Italian presidency this year. As you probably know, our institute has been given by the Italian presidency the task of co-chairing one of the official engagement groups of the G7, the Think7, T7, and we are responsible in particular for a task force to coordinate a task force which includes global health. And indeed, we have carried out several activities to see how the G7's global health agenda can be advanced. We think that this should be considered as a crucial part of Italian government state objective to promote the G7 outreach to low and middle income countries, particularly in Africa, which, as you know, is the regional focus which our government has chosen for this year, G7. That's why we want, for all these reasons, to focus today as much as possible, in particular on the proposals, recommendations, suggestions that we can advance for the G7, and specifically how we can address to the leaders. Also because, and this is another point I would like to stress, in the coming days as co-chairs of the T7, we will work on a final set of recommendation covering almost all aspects of the G7 agenda, and we'll do our best to take also into consideration what will emerge from our discussion today. The meeting will be opened by Ambassador Marco Giungi. I very much thank Ambassador for being with us today. And then a brief introductory speech by Stefano Vella. You know, all of you know him, of the Friends of the Global Fund Europe, who has been, so far, will continue to be a very active and productive member of our T7 task force. And we will then have a part specifically dedicated to the presentation and discussion of the paper. Last but not least, we will have an expert panel who includes leading experts of the major organization working on malaria and more broadly global health. I would emphasize that we have received from many of them extremely valuable inputs and suggestions which have helped us a lot for the paper's drafting process in general to discuss the issues that are the center of this meeting today. So I wish to thank all of you again for being with us today, for accepting our invitation. And now without further ado, I have now the pleasure to give the floor to Ambassador Giungi for the introductory speech.
Thank you very much, Director Greco, and good afternoon to you all. Thank you for inviting me and for organizing this meeting, and a warm welcome to all participants. I would say a very timely meeting on a subject which is very important for the G7 group, but I would say for the whole international community. If you allow me an anecdote, a couple of days ago, while talking to a friend about my participation in this meeting, I said it's about fighting malaria, and he said, malaria, they found a vaccine. Like saying it's over. And to which I only objected to the use of the word found. Yes, they found a vaccine. Actually, they found two, which is twice a good news. And I will not say that this is the only good news, but we'll have to face reality. We are off track in our fight against malaria. Still, as of today, malaria hits severely, mostly the African continent, which has been said is also a geographical priority for the Italian presidency of the G7 group. On the whole, 11 countries in Africa carry 70% of the burden of malaria as of today. So there have been progress, of course, important progress, such as the vaccines, plural, but there have been setbacks. We can partially blame for the setbacks the COVID pandemics and the related effects on healthcare systems. But also, of course, the climate change. It was mentioned, the nexus between climate change and health. Of course, I mean, we all know malaria is carried by a vector. It's a parasite carried by a vector, which needs some specific climate and environmental situations. But the climate change affects the environment, affects the climate. It's a climate change. And so the environment for the mosquito. And hence, the illness is shifts to areas previously unaffected, which lack how to say, both the software and the hardware to fight malaria, both the factual tools and the professional capabilities rather. And I would say the Darwinian laws of evolution, because under Darwin rules, evolution is an arms race, in which if you developed new weapons, the opponent species will develop new defenses and so on. It's an endless arms race unless one of the opponent faces extinction, which we hope in this case will happen sooner or later. And among this evolution, there are AMR, or insecticide resistance, drug resistance, new kind of resistance which are being developed. And so we're still far from eradicating malaria, and hence we'll have to gear up international cooperation in order to continue fighting it. We look with very much interest to certain initiatives such as the African Vaccine Manufacturing Acceleration, AFA, by Gavi, which builds on previous experience and histories of success in ensuring financial support to manufacturers in order to produce in a viable and sustainable way vaccines, in this case in Africa. And malaria being a priority illness of the continent, they might enjoy some results from this initiative. Among the progress, I would also list the new awareness that Director Greco was mentioning of a nexus between climate change and health. It is a recent, I would say, recent awareness, but which has been sanctioned also in COP28, and our hope is that financing for climate can also benefit health, and indirectly or directly also the fight against malaria. As you know, Italy has launched its own climate fund with a capitalization of over 4.2 billion euros. Of course, I mentioned vaccine, which is very promising, but two vaccines have reached WHO's recommended status, thanks to the joint effort of WHO, Global Fund, and Gavi. Different countries, if I recollect, it's Kenya, Malawi, and Ghana, and now Cameroon have launched a campaign of immunization. But WHO itself recommend to use a mix of interventions, because like in fighting climate change, we need mitigation and we need adaptation as well. And in this case, as in others, the two aspects of international cooperation and intervention, mitigation and adaptation, are somehow mutually supportive, because intervening on the root causes of malaria will also help indirectly the healthcare systems, which will be freed by particular stress in certain areas, while on the other hand, intervening on healthcare systems, of course, will help relieving at least the effects of the illness itself. So adaptation and mitigation are indeed mutually supportive, as it is in several cases. So hence the importance in a way in this mix of intervention, which is recommended by WHO and agreed upon by most experts, not only investing in vaccines, which is important, but as well on prevention, preparedness, and response, control, if we take into consideration the possible expansion of the vectors to areas previously unaffected, the control and I would say the territory control is also very, very important. And to this end, international cooperation is indeed essential and crucial. On one hand, we rejoice and we commend the fact that several actors, more and more actors, are intervening in this area, including the fight of malaria and in general for PPR in the health sector. On the other hand, this need causes an increased need for coordination. In order to make the different actors, the action by different actors more efficient and avoid duplication and wastes. And in this sense, we do support the Lusaka agenda process, which is pushing for impactful coordination among the existing global health initiatives, starting from malaria intervention, as discussed in the recent joint board call between Gavi, Global Fund, and GFF, in order to catalyze action towards the achievement of long-term shifts in the ecosystem for the advancement of the global health agenda. That's something we very much believe in, and I will not steal too much of your time, but just thank you once again for giving me the opportunity to address the meeting, and thank you once again for the important job you're doing.
Many thanks for providing us with very important considerations about the evolving malaria scene, the distinguished features of this scene, and also by not less important, emphasize some priorities, which everybody expects to be also at the center of the work of the Italian presidency. And of course, your last point about the need to reinforce coordination among the main actors, considering that we have to do with a very complex architecture with many actors, and there is the need, of course, to perhaps increase the synergies between them, although we can, I think, rather easily identify their respective added values and specialization. So they are all absolutely necessary to advance the malaria agenda. So thanks for setting the stage for this debate. And then I will give the floor to Stefano Vella. Here represents the Friends of the Global Fund Europe, and is also, I also recalled at the beginning, working with us for the T7. So please, Stefano, over to you.
Thank you very much. Thank you, Ettore. Thank you, Ambassador Giungi. It's a pleasure to be here. I will be short because with this group of experts, I cannot go into much details that actually will be presented by Francesca about our paper, our joint paper, the International Affairs Institute that we produced on malaria. But among that, also, as you alluded to, we worked also on the G7 health that actually tomorrow will be presented in the joint stakeholder meeting of the Ministry of Health. And so we also participate on that. In fact, I'm here also as a president or vice president. I never know if I'm president for Italy or vice president for in the Friends of the Global Fund, because I have been a member of the Global Fund, even of the board, when Italy was an incredible supporter of but we are still very much supportive of the Global Fund, thanks to the Ministry of Foreign Affairs, actually. And what about malaria? Again, I'm not here to discuss the paper that will be presented by Francesca, but indeed we need to say that malaria is still a pandemic. We are forgetting that we have a few pandemics ongoing. Malaria, 600,000 deaths, not just in 1 year. HIV is still there, 1.5 million infections last year. And the Global Fund is the global initiative that is working against these three pandemics, because these are pandemics. But they are not only the one in the horizon, actually, because just to say that I'm a member of the Pandemic Fund, you know, this new initiative. Italy is supporting the Pandemic Fund. We hope not to have too much to do in the future, but we need to be prepared. And it's an incredible initiative. I hope it will go through. But it's not the issue of today. What I'm saying is that malaria is still a great pandemic, a lot of death. And unfortunately, we had examples like the Pakistan, the climate change issue is there because, of course, malaria is pretty much, let's say, involved in the issues of the emerging challenge of climate change. Is a mosquito-borne disease. Let me remember that mosquitoes able to transmit viruses are moving. Even here, we had a little episode of West Nile, not too little, and dengue is coming. And we have also had chikungunya virus in Italy. Hello. So that's we need to look forward. So as you said, we are a little bit off track in the fight against malaria. And personally, that's a personal that maybe is not appropriate, but I was a member of the EMEA. At the time, it was in London. I was a member of the scientific advice. And I saw on my table the advice for malaria vaccine. That was 2010. So we didn't give a green light at that time as scientific advisors because the vaccine was not, we didn't have enough proofs. But then what was missing was the tests on the ground. And this is what WHO did. And actually, this vaccine proved to be at least partially effective, particularly on kids that are the most affected. So we congratulate, let's say, for these two vaccines coming. However, as you said, and the same thing that we say for HIV, for which I worked many years, prevention is not one shot. Prevention is a kind of, so to prevent malaria and close the gap, we need different intervention. I don't think the vaccines will be able to have, they will have an impact, but they will not close the gap. So we need to really to go to do something more and more against malaria for prevention, which includes the bed nets, which includes the fact that resistance is coming, not only for the drugs, but also for the insecticides. And so we are a little concerned that it's not only it's not over, but we may not reach the 2030 goals. This is the reason why we enclosed the malaria into our T7 paper. You know that the T7 is just a position paper that goes to the G7, so they can take it or not. But I also have, maybe I'm doing too many things. This is what sometimes they tell me, my partners and wives. I'm also involved in the G20, T20. And I know that they are very interested in malaria, of course, and also they have an incredible epidemic of dengue, and they are very, very interested. Actually, I sent them our paper that we work together on local production. That was for Africa mainly, but it's something that it's for the entire world. So the local manufacturing is one of the issues that we put in our T7 paper, and I think it will be one of the issues of the Italian G7. So we are very proud of having G7 this year because it's really a very important year for global health. If we are able to make people understand, but so not only the stakeholders or the politicians, etc., but even people that we are not alone in this world, that global health is an issue of security, is an issue of development, is something that can help countries to develop. And also, I think, it's a matter of peace in the world. So I'm closing it and give the floor to Ettore. Thank you.
Thanks a lot, Stefano. Now we move to our part specifically dedicated. It will be in any case very short to our paper, which has been, I think, distributed among all of you. And so I give now the floor to my colleague, Francesca, please.
Thank you. Today I'm presenting the paper that was very much a team effort of the Global Governance and Multilateralism team. And it was originally drafted by former researcher Irene Paviotti, and then with the contribution of Director Greco and myself. We would also like to thank the Friends of the Global Fund for their contribution and the insights that they have provided throughout the drafting of this paper, which were absolutely crucial. So the report, I will also be very brief to let the stage to our panelists, and some of the main themes have already been touched upon. The report does illustrate the current state of malaria, and it highlights the main aspects, the main issues and challenges, and the main actors involved in the fight against malaria. It is inscribed within the broader picture of the G7 commitment to the health sector, and so to promote and strengthen global health architecture overall. The first section of the paper provides an overview of the current state of malaria. We know that after 2 decades of increase in incidence and mortality, in the past few years, we have seen an increase of incidence of the disease. And this can be put in the context of a redistribution of global fundings due to the global pandemic of COVID-19, which has indeed affected other life-saving services that impact other diseases, including malaria. After providing the initial overview, We also look at the connection between health and economics. And so we know that malaria elimination is inscribed in the third goal of the Sustainable Development Goals, but really touches upon all the main 17 SDGs, which really highlights the nexus between economics and development. Secondly, a following section of the paper is dedicated to the challenges. They have already been mentioned. The main challenges involved in the fight against malaria are today climate change, because it alters the living conditions of both humans and vectors, and therefore it increases uncertainty on where, how, and which scale transmission will occur. Secondly, as mentioned, another challenge is antimicrobial resistance, or AMR, and this might have an impact on the effectiveness of insecticides, treatments, and might even complicate diagnostics. So after addressing the challenges that are involved in the fight against malaria, a section of the paper looks at the innovation and the progress that has been made in the field of innovations. And this can be grouped in three main areas. The first one being research and development. The second one being the development of new tools, like, for example, the next generation dual ingredient bed nets that are meant to counter the increasing antimicrobial resistance that we mentioned. And the third area is the one of vaccine. We know that this year, 15 African countries will introduce routine malaria vaccination. So of course we address this topic in the paper. And to take full advantage of the innovations and the progress made, fundings is needed. And of course, this set the ground for a section dedicated to the malaria funding landscape. We know that over the past 20 years, fundings in this field has been stable, but the need has increased and the population at risk has expanded. And this is addressed in a section dedicated to fundings. And then lastly, we also look at all the actors involved in the malaria architecture, and we also look at institutional coordination and to which degree and in which forms the key players interact and cooperate. Key players can be found at the national level. So we have governments being at the core of health institutional architecture, and can be also found at the international and regional level. So this leads, this picture leads to a final section with the concluding remarks, but most importantly, to a set of recommendations that can be, grouped to three main areas of interventions. The first one, the first set of recommendations stresses the need to put to give relevance to malaria within the G7 agenda. The second set of recommendations revolves around the fact that the fight against malaria can be seen as a laboratory to really push for innovation and innovative global health strategies. And lastly, but not less importantly, the last set of recommendation really targets the importance of investments. And now I will leave the stage to our panelists and over to you, Ettore. Thank you.
Many, many thanks, Francesca. You all have had the opportunity to have at least a look at the paper, and perhaps we, again, would like to concentrate in particular on the recommendations. It's a large set of recommendations on many issues, on many aspects. Let me just tell our online participants that if they have comments on questions, please feel free to write those comments on questions on the chat. We will then take them in consideration. I'll pass over to our expert. So now I have the pleasure to give the floor to Peter Baker from the Center for Global Government. It's a very well-known center working specifically on global development. So please, Peter, over to you.
Thank you very much. And thank you for the organizers, for IAI and everyone for inviting me to this event. And congratulations to the author on this important paper. So for those who don't know us, we're a think tank based in Washington and also in London. And I'm the Deputy Director of the Global Health Programme here. I think fundamentally, so I have 5 minutes to offer some reflections on the report, which I think makes a very strong case, particularly around the need to increase priority on malaria, that progress has stalled, global progress on this important topic has stalled, and that more resources for malaria are needed. I certainly agree with this. We need to seek more funding for malaria. I think if you look at it from any perspective or any definition, malaria is a priority. Yeah, it kills 600,000 or so people a year. It exacerbates inequality. It prevents development, and perhaps importantly, there are a good package of really very cost-effective interventions to tackle this. So it's hard to think of many areas that are in some ways a bigger priority. But to offer maybe another perspective on this issue, we need to plan, I think, for an age where there may not be more money for malaria. And then we need to think what that means. Domestic financing is very difficult in many countries right now. I'm sure you're aware. Government expenditure is not rising fast at all, which is the source, of course, of all healthcare expenditure, or the majority of healthcare expenditure. Debt repayments are very high, fiscal space is very limited. Donor funding is also constrained. G7 growth, as you all know very well, is limited. The Global Fund replenishment, there was a lot of celebration of the replenishment, but if we take a cold, hard look at the numbers, in fact, if anything, if you adjust for inflation and you look at what is really committed, it probably has 10% less purchasing power than in the previous replenishment. And that in some ways is not surprising given the current fiscal situation in many wealthy countries. There are also a range of competing global health priorities. Just even within malaria, you've now got vaccines as well as all the previous technologies, as we just talked about. And there's not enough money for the old technologies, let alone adding in new. There are rising non-communicable diseases. And there are a range of factors outside of health, but with big impact on health, like climate change and the World Bank reform that's going on, which in fact are distracting donors and reducing the focus on malaria. You may have heard just recently that the World Bank has asked for $100 billion for IDA, as an example. We have to be planning for the situation, I think, of how we get more from the money we have, as much as how we get more money. So I would encourage us to look at that and perhaps to look at that with the R21 vaccine in mind, because I think, as the report rightly says, this is an exciting new development, and it must find its place in the package. But what is the right place? What's the priority compared to bed nets? I think too often we sidestep this difficult issue and we say, oh, let's just include it, but find its right place naturally. But it won't unless we do the right analysis and we have the right institutions to weigh up the different choices. There is simply not enough money to go around every malaria intervention, and all countries are going to have to make difficult choices. So I think I'd like to raise the idea of a slight change in perspective here and think, how can we get to a situation where developing countries take charge of the malaria budget in total, including their own money and also donor money? How can they set up processes to consider, for instance, the role of the R21 vaccine versus other choices? Maybe they'll decide to reduce spend on bed nets and increase on vaccines, or maybe they'll wait and do vaccines another time. But how do we make it so that's their choice? How do we make sure that they have the evidence, they have the head-to-head trials, they have the global guidance? and they have a global health architecture that supports them, so that Gavi and Global Fund and others are really willing to kind of pool resources with domestic resources, and back kind of domestic plans. How can we get to that stage? So I'd just like to leave this for the panel to discuss and for you to think about. Malaria is a global priority, clearly, and it deserves resources. But I'm not sure we're going to get that much more. And if we don't, how are we going to get the most for what we've got? And how can governments and donors come together to have the highest impact on this critical issue? Thank you.
Many, many thanks. Now we move to the our panel and give immediately the floor to Diane Stewart from the Global Fund, please.
Thank you so much. And thank you to the Istituto Affari Internazionali for having us here with the Friends of the Fund. It's great to be here today, and especially with all of our colleagues who care so much about malaria. And a special thanks to the government of Italy, long-standing supporters of the Global Fund, and also a great contributor to fighting back malaria, as we all have collectively been doing. I think based on what everybody has said already today, I think the status of the fight against malaria is very reflective of the state of the world as we find it, right? In terms of a very difficult context and polycrises, so multiple things that we have to take into account as we try to think about how to move forward on malaria. As many speakers have pointed out, the challenges in this fight are many, and not all of them under control of health programs. So you have climate change, you have extreme weather events, we have drug and insecticide resistance that we're trying to manage, but also for many countries, including donor countries, there is the debt crisis. Many of the countries most affected are the lowest income countries in the world whose economies have not recovered from COVID. And this is affecting the ability of both donors and countries where we work to invest in health systems. Also, we have population growth in sub-Saharan Africa, which is also, because it affects under 5 children so much, really affecting the fight against malaria. Africa's population is projected to double by 2050. And so the health systems are under incredible strain and will continue to be. In many countries, in many African countries in particular, malaria is the main driver of visits to healthcare facilities. So it's also an incredible burden on those facilities, and therefore one of the greatest public health threats in sub-Saharan Africa. And that has a knock-on effect of hindering economic growth. So it becomes a very vicious circle that we've been trying to interrupt for the last 20 years. WHO estimates that $4 trillion in economic gains would be generated by eliminating malaria by 2030. So there is a huge incentive, especially under the current G7 discussions around relationships with Africa, a huge incentive to put malaria at the center of those efforts, just in pure economic terms, let alone the moral issue of children dying. In the past 20 years, the Global Fund has proven that infectious diseases, including malaria, can be forced into retreat, right? We've proven that we can have an impact. If we take an example of the Sahel, so a very troubled region at the moment, Mali, Niger, Burkina Faso, these are among the 5 countries most affected by malaria globally. And since 2003, the Global Fund has invested nearly $1.5 billion to fight malaria in that region, supporting the distribution of mosquito nets, seasonal malaria chemo prevention, for children under 5, and preventive treatment for pregnant women. We also support, of course, diagnostic test treatment and health education programs, so environmental control factors, those kinds of things. Those investments have yielded incredible results. In 2022 alone, in Niger, 85% of the population had access to insecticide-treated mosquito nets, so poorest country in the world, very affected by instability. And yet, 85% of the population protected by bed nets, 95% of suspected malaria cases were tested and treated, and 4.6 million children benefited from seasonal malaria chemo prevention. So even in some of those most difficult circumstances, we can actually make progress and have impact. So it's not a terrible situation, right? We can do it. The Global Fund works closely with countries and partners like WHO, Gavi, and so on, to ensure that all of the tools that are currently available are used effectively. And I think this, as Peter's pointing out, this is our biggest challenge going forward. Together with Gavi and Unit Aid, we supported the clinical trials for the RTSS vaccine for malaria. And now we're also investing in this new generation of bed nets, so the dual insecticide treated bed nets. So it has 2 insecticides in it. If the mosquito is resistant to one, the other insecticide will kill it. So they're highly cost effective, and they've shown that they can reduce malaria cases in children under 5 by almost half. So the rollout of those new dual insecticide bed nets is as important as the rollout of these 2 new vaccines. And effectively leveraging all those innovative tools is what's key to getting back on track and making progress. Gavi and the Global Fund have been working closely with countries to introduce these innovative interventions as part of a holistic package of measures. But I think we shouldn't underestimate the complexity of this, right? This is something that's going to really require some partnership. As other speakers were pointing out, we need really good guidance on what the differentiated introduction of these new tools will look like. We can't assume countries will not have enough money for everything everywhere. So how do we make sure that we're giving them really good guidance, that indeed they are in control of how they use those different interventions? And I think, and we, Gavi and Global Fund, have been pushing WHO for better guidance, frankly, because we need more detailed, more bespoke guidance for each country. It's different in every country, and the mix of interventions will be different. So I think we need to coordinate better as the community, and there are many players, as you pointed out, who are working on malaria. But I think for ministries of health and for vaccine programs in countries, it's extremely challenging to figure out how to do this. We're also working together to strengthen the health systems that support those programs. So that's obviously important as well. Service delivery programs, supply chains, cold chain data systems, all of these are critical public health functions that we need to support. And finally, as the Global Fund, we are continually tailoring our programs and approaches to reach populations most at need. And I think that flexibility, given climate crises, given the conflict in the areas most affected by malaria, we need to be pretty light on our feet. So during COVID, we showed that we could change quite quickly how we distributed bed nets, for example, to ensure that the distribution mechanisms happened even during lockdowns or where people didn't want to go to health centers or to the market where they would normally get their bed nets. So I think that has enabled us to reach vulnerable families, and I think we need to continually innovate, and that's where our community engagement is so important, because we have to keep adapting to make sure we're effective. So effective tools, strong partnerships, targeted solutions are essential, but it's not enough. We do need that political leadership, and we need the financial commitment. Both of those things are crucial. So we've heard there's a sort of terrifying $3.8 billion gap in the funding for the amount that's invested and the amount that we need for malaria. And to Peter's point, I don't think we're going to find that money in the next year, right, in terms of what we need. So how do we make the most effective use of the money that we have? And we think that G7 group and Italy's leadership in particular can help to advise on how to best use this. And I hope and look forward to working together so that we can look at these recommendations, see how we can integrate this into Italy's leadership role in the G7, and make sure that the G7 commitment over the last 22, 24 years in Gavi's case is continued so that we finish the job before 2030. Thank you.
Many thanks.
Grazie direttore, buongiorno, ambasciatore Giungi and tutti gli altri. Thank you so much for having us here. I think between Diane, Francesca, Stefano and Ambassador Giungi, you've pretty much said most of it. I will just complement a few of the things. Indeed, over the past 24 years, Gavi had at its very, heart, saving children's lives and addressing inequality and inequities by introducing access to life-saving vaccines. So over the past 24 years, we've vaccinated more than 1 billion children, saving more than 17 million lives. This is something that I think we can all celebrate together, and it wouldn't be possible for all of your help and support. Now, we talked about vaccines. I've heard, Pete Baker talk about, vaccines and also other preventative measures. Indeed, it's twice the good news, as you said it, Ambassador Giungi, that we had one vaccine in the beginning, The challenge with that, it was introduced in 2019 in trials in 3 countries, Ghana, Malawi, and Kenya. The challenge was that that was not enough to address the demands that came from Africa. So then the second vaccine came around, the R21, that was pre-qualified recently by WHO. And indeed, I think to Francesca's point, we are planning to roll out the 2 vaccines in 15 countries in 2024. Now, there were constraints in terms of supply, but there are also there's also the reality that these vaccines are not exactly amongst the cheapest. So we are trying to deploy our market shaping capabilities to lower the prices, but it is something that you know, does come at a cost. So it's really that to have to look at. Now, Dan mentioned a couple of times the togetherness, the way we collaborate together, and I think I would like to emphasize that point. Because while it's very clear and critical that vaccines should be used, and the malaria vaccine should be used to fight this disease, they should not be the only tool, and they must be, so they ought to be, but they must be used alongside other malaria interventions, such as insecticide-treated nets, use of antimalarials, and the adoption of highly effective treatments. Now, if that wasn't done, we cannot make sure this is an efficient outreach, because individual approaches are only partially effective by itself, whereas when you bring them all together, it ensures that it has the maximum benefit. Now, all of these tools, another element, we talked about children, if used together, if those children were to contract malaria, they're less likely to develop severe illnesses, and more of them will survive and reach adulthood, which is something that I think we all would like to see happen. Now, there's strategic collaboration between the various institutions. So we work with WHO, as you know, for policy guidance, recommendations, also with UNICEF for procurement and delivery, but also with the Global Fund to ensure that these investments are coordinated. And it's not just, we're not just saying that we do things, we do things, we're constantly challenging ourselves to see how we can better collaborate. Dan knows that last week we had Gavi and the Global Fund had their first joint board discussion on malaria. And there was unanimous support that this work had to continue in order to maximize the impact of our joint interventions and pave the future for even better collaboration. Now, talking about the G7, I'm personally very grateful that we're here today in Rome, that Italy, under the G7 presidency, decided to keep health as a very important topic. Also, the strengthening the component of the partnership with the African continent, because at the end of the day, as we've all said, most of the fatalities happen in Africa. And alongside the health component that incorporates, you know, the pandemic preparedness, the addressing the impact of the climate health nexus as well, and also the importance of AMR and what we can do to actually address that. So speaking of the burden of malaria on African continent, I think it is a key condition for inequality reduction and economic development, which is a priority for Italy, but should also be a priority for the other G7 member states. And we're hoping that with your presidency, you can inspire others to follow through. The second component is controlling and eliminating malaria is indeed enabling a better pandemic preparedness response. We've hopefully learned from what we all lived as a as a global community during COVID, and seeing that PPR component on the G7 health track, that is encouraging and inspiring to us. Thirdly, from a climate health nexus perspective, indeed, as you were saying, Ambassador, these vaccines, these diseases are vector-borne diseases, right? Such as malaria, cholera, yellow fever, cholera being waterborne, of course. And yes, it is important to call for investments in ensuring that these vaccines are being rolled out and continue to save lives. Now, Diane was very gentle when she encouraged continued financial support. I would like to say that we count on all of you here to bring to the G7 discussion that, yes, as Pete was saying, it is a tough time. The financial resources are shrinking. And yet, the malaria is one of Africa's deadliest diseases. It kills almost 500,000 children every single year, children under the age of 5. And I don't think we can or we should put a cap or a price on, a child's life. And so therefore, Gavi has its replenishment coming up. The Global Fund will be having theirs next year. And I think it is important to have the G7 mobilize whatever resources available to ensure that these two replenishments are successful so that we can move towards the SDGs in 2030 and indeed give the world the hope that it needs. I will stop here, but again, thanking you so very much for giving us the opportunity to speak with you. Grazie.
Thanks a lot, Mr. Molnar. I have now 3 online interventions. I will start with Bruno Moonen from the Gates Foundation. Please, over to you.
Yeah, thank you very much. I agree with the previous speakers on all fronts, and I'll just highlight a few additional things here. And first of all, it is correct that there is, of course, stagnation in the fight against malaria, but I think it's equally important to remember that the current investments actually avert a lot of cases today. And that malaria remains a very, very good public health investment. Now, the stagnation actually forces us to ask the question, how can we do more with the resources that we have or will have available today or in the near future? And I agree with the previous speakers and with Pete Baker that ideally, countries should be in the driver's seat. They should have strong, data-driven national strategic plans that really look at what interventions they should prioritize and how they should tailor their interventions also geographically and by high-risk group. And that is not a trivial exercise. I also agree with the speaker from the Global Fund that today we feel, as the Gates Foundation, that the guidance from WHO needs to improve and needs to be clearer on how these prioritizations should be done in the future. And these are not just prioritizations for malaria, these are also prioritizations within the vaccines envelope, where countries will have to make choices on which malaria interventions to prioritize and will have to make choices on which vaccines to prioritize for introduction or scale up. I think this is a little bit of a new situation we find ourselves in. To my knowledge, I have not seen a time where we had 2 very important financing mechanisms, in this case, the Global Fund and Gavi, that both had preventive tools for one disease. Typically, it's one of the mechanisms that kind of holds the prevention tools for Gavi, for example, many vaccine preventable diseases, the Global Fund for the 3 diseases it tackles. And all of a sudden, we find ourselves in a situation where 2 different financing mechanisms actually hold prevention tools for the same disease. And I think that's why the collaboration that we have insisted on and is currently happening between the Global Fund and Gavi is absolutely crucial. But I think it also puts a question around some of the contributors to both Gavi and the Global Fund on where they have to put their malaria money. And I don't think that that's a very easy question to answer. And I'll leave it to others on the panel to maybe address this one. Next point I would like to make is that I think it has been mentioned, we have a number of innovations that are already recommended by the WHO, and we need to make sure that we accelerate actually the introduction of some of these innovations. I'll mention 2. One has been mentioned several times, the dual AI nets that can not only, let me make a point here, they don't just address resistance, Because you're working with actually two active ingredients, they also are a tool to delay the emergence of resistance, and they are therefore really, really critical in the fight against malaria to address resistance of mosquitoes to these insecticides, but also to delay it. And the same goes for the absolute emergency we are facing when it comes to early signs of resistance of the parasite against some of our treatments, specifically in Africa. This used to be a problem in the Greater Mekong subregion. The world decided to not just contain resistance then in the Greater Mekong subregion, but to go for elimination. And we see the results today with, of course, the exception of Myanmar, with tremendous progress being made in Cambodia, Laos, and Vietnam. I mean, I was in Vietnam and Laos a few weeks ago. Vietnam has a few hundred cases in a population of 90 million people. That is an incredible achievement. Don't forget that there was malaria, 40% prevalence in the population 25, 30 years ago in the same region. And so progress is definitely possible. But just to say that we need to pay attention to addressing parasite resistance against the treatments, and we need to really find a way to accelerate the bringing online of other treatments. Today, artemether-lumefantrine, an amazing drug, takes roughly 85% of the market. If we want to address and avoid and delay resistance, we need to diversify the anti-malarial market. I'll leave it at this and hand it over to other panel members. Thank you very much.
Many, many thanks. Before giving the floor to the next speaker, let me just read a comment we are just received from Jean-Paul Nguyen. Greetings from Paris. This is not a question, but rather a suggestion as a contribution to the G7. We are all aware that malaria is a disaster, just like AIDS, and there is no solution yet for its eradication. I propose the establishment and structuring of civil society in Europe in order to be able to rely on trained and qualified volunteers to raise awareness among the population of the affected areas in the south by providing them with impregnated mosquito nets as part of European funding. Thank you and see you later. Of course, feel free also to make comments on that. Now I have on my list Crystal Birungi from Uganda Virus Research Institute. Please.
I'm Birungi Crystal. I am from the Uganda Virus Research Institute. I work on a project called Target Malaria that is developing genetically modified mosquitoes using gene drive to reduce the wild-type mosquito numbers, so the mosquitoes that are spreading malaria, thereby interrupting malaria transmission. So I'm also a speaker with the Global Fund Advocates Network Bureau, and the subject of malaria is really very close to my heart because it has pretty much determined my entire life, I would say. I'm in certainly the rarer position of being somebody that was both really heavily affected by malaria and also is now fighting to end the disease. So I will not dwell too much on how terrible malaria is, but just to give you a little bit of insight on this is a disease where when I was growing up, there were multiple times when I was worried that I might die or that my siblings might die. In fact, the very reason why I dedicated my life to fighting malaria is because one time when my youngest brother was about 5 years old, I remember watching my mother sponging him off all night, trying to keep him cool because he was seizing. And these seizures were because he had malaria. So I knew we had a treatment for it. We just could not afford it. And this was just a reality. And a lot of people in Uganda today do not even think of malaria as a crisis. They think of it as a way of life. So we still have people that are determining how many children they give birth to based on the fact that some of them will die from malaria. And this is something that, for me, is something that we should not allow. It should not be the case. You should not have a whole population of people that already give up some of their children to death to a disease that is preventable, that is treatable. So this is the pain that I see every day. When we say a child dies of malaria every minute, this is where the numbers are coming from. These are the communities I am working in, and it is absolutely devastating. But at the same time, we cannot discount the huge progress that we have made, because when I was growing up, it was about, in Uganda, 1 in every 6 children did not make it to the age of 5, most of them because of malaria. Today, that number is closer to 1 in about 24 children. So it's still a terrible number, and we have to do something about it, but it's such a big difference. So we need to stop the idea that we could be complacent, that we've done a big job and we fought malaria. So the tools that we have definitely are doing a big job, because we don't want to go back where we came from. But at the same time, it is not acceptable that we still have this many children dying, this many people suffering from a disease that we could prevent and treat. So that is why I'm really excited when I hear about, regulators and regulation being put in place to accelerate some of the wonderful things we have today. I'm a very big fan of innovation, because clearly we have seen that we will not get to malaria elimination by 2030 if we do not do more. So when you hear about interventions like the vaccines, interventions like seasonal malaria chemo prevention, and even what Target Malaria is trying to do with the innovation into gene drive to try and fight malaria, it's going to take each and every one of these tools. And honestly, it's going to take funding for these tools. It's just the way it's going to be. And we are almost at the home stretch. So I think it is absolutely possible that if the world comes together, we've seen that we can come together. When things are important enough to us, we can. Getting to where we've gotten in the malaria fight, that is evidence of what can happen when the world comes together. But also look at what happened with COVID. With COVID-19, the world came together, and in an amazingly short amount of time, we solved what at some point probably looked like an insurmountable problem. So I believe that it can be done, and I believe that innovation is going to be key to this. I believe cooperation is going to be key to this. A lot of the political will is definitely going to be key to this, both in the developing countries or the countries that are receiving most of the aid for malaria prevention, but also in the donor countries that have been really dedicated to this fight for this long. So I think we need to just recommit to just think about the commitments that we've made, and definitely go ahead and meet those commitments. So I won't take up too much more time, but yes.
Many thanks. So next in my list is Joy Fumafi from African Leaders Malaria Alliance, ALMA. Please, over to you.
Thank you very much, and hello everyone. Apologies from Joy. She was unable to join due to an agent engagement, so she's asked me to jump in. I'm Elizabeth Chizema. I'm an officer from African Leaders Malaria Alliance. African Leaders Malaria Alliance is a coalition of all African Union heads of state in Africa, and they came together and agreed that it is important to eliminate malaria, and they have a goal of elimination of malaria by 2030. So ALMA Secretariat works with the heads of state in Africa to try to raise political will, to work with the regional economic communities, as well as with the youths, bringing up accountability and action towards, as well as tracking malaria towards malaria elimination. So as all the other previous speakers have said, malaria should be prioritized. Unfortunately, for a long time, people have believed that malaria is there with us and they take it like any other ordinary disease. So there's an urgency to really change the mindset and begin to see malaria as it is, a huge burden, particularly in Africa, which exacts a big toll. It's an unacceptable number of cases and acceptable number of deaths. So how do we move forward with that? I know challenges have been mentioned, and there is hope. There's the good news. For instance, Cabo Verde recently was declared malaria-free, was certified malaria-free. So I think there's still hope that we can reach this goal. And therefore, for us, we need to understand that investing in malaria has a huge return on investment. We also have malaria as a backbone for the health system. So strengthening malaria, responding to malaria, supporting malaria will also result in stronger health systems. Others have also said that malaria is not just a health problem, so we need to look at better coordination, better collaboration. How do we bring even non-traditional players in to fight malaria, to support malaria? I think there's also been mention of political will. I think how do we harness, how do we support the heads of state to really believe and understand that malaria is a huge problem in the continent, it's a huge problem in their countries, and how do they then prioritize and begin to see malaria as a key disease? I think heads of state, ministers have responded to COVID, to cholera outbreaks. So how do we get them to respond to malaria in a similar manner? And then we are looking at a good pipeline of tools that are coming out, both for vector control and for case management. But developing tools is one thing. How do we get them to reach those that need them? How do we get them to reach the last mile? I think that we have interventions, we are talking of targeting interventions, but even these targeted interventions are still not at scale. So how do the G7 countries then support countries to ensure that we reach the full scale of those targeted interventions? I think that is the way then we can eliminate malaria. When you look at resource mobilization, yes, we indicate that domestic resource or financing is a challenge, but how do we support countries to understand that within their own countries, there is potential, there is people with resources? How do we get people to come in? The End Malaria Council has been supporting countries to establish end malaria councils and end malaria funds. They are engaging traditional leaders, they are engaging faith leaders, they are engaging private sector and government line ministries as well to come together, work together, and support the fight against malaria. So really by working together, that's the way we can eliminate malaria. At global level, we have the RBM partnership that brings all the partners together. How do we support RBM? How do we strengthen and finance RBM so that they can better respond and support countries? Otherwise, I think all the other members of the panel have also mentioned that, but just to emphasize that malaria must be kept as a priority at all levels, be it at household level, individual level, right up to the global level. Thank you.
Thank you very much. Now the floor goes to Guido Maranghini from the Italian Ministry of Health.
Thank you, Director Greco. Good morning, good afternoon, and good evening, everyone. It's the typical formula we use to greet the delegates that connect from all across the globe to our virtual G7 working groups. I would like to thank EI for the invitation to this interesting meeting, also on behalf of Dr. Sergio Ievicoli, Director General for Communication and International Relations at the Italian Ministry of Health. I'm glad to attend as a representative of the Italian Ministry of Health, but also as a specialist in public health. As an Italian medical student, malaria seemed a negligible disease, not a neglected one. During an internship in Geneva, I deepened my knowledge on global health issues, and I became familiar with the work of the United Nations and of the Global Fund, and Gavi as well. During those meetings, I realized the significant burden that malaria carries at the global level. But it was while I was working for NGOs in middle and low-income countries that I deeply understood the dramatic threat that malaria poses. These past experiences made me listen with even more attention to the enriching interventions made by previous speakers. I believe they have presented a comprehensive overview of the challenges and opportunities for malaria elimination. My short contribution instead will be related to the health track of the current Italian G7 presidency. As you might be aware of, three main priorities have been established. The first one concerns the strengthening of global health architecture and prevention, preparedness, and response to future pandemics. The second priority focuses on lifelong prevention for healthy and active aging. The third one highlights the importance of the One Health approach and the need to recognize the strong interconnection of human, animal, and ecosystem well-being. You might wonder if any of these priorities could be related to malaria eradication. Well, I believe they do. Let me briefly explain why. Strengthening a global health architecture is a strategic process to apply the lessons learned during the COVID-19 pandemic. As Professor Bella stated, also malaria is a pandemic. Therefore, we need to invest on the so-called PPR, prevention, preparedness, and response. Efforts in this sense will provide significant steps forward in the fight against communicable diseases. Furthermore, equity is the principle that has to guide the objective of the instruments to enhance the global health architecture. Addressing the social determinants of health will have a positive impact on the contrast to those diseases influenced by poverty. And as we know, malaria is one of those. On the second priority, as remarked on the related concept note that has been issued, a strong role is assigned to innovation. The investment in digital health and the appropriate use of artificial intelligence can scale up not only the response to an aging society, but also the need for groundbreaking tools to tackle infectious diseases. Telemedicine, for example, can play a strategic role in this sense. The third and last priority is by far the most related to the challenges of malaria eradication. Implementing the One Health approach will improve interdisciplinary cooperation to protect from the consequences of climate change, vector-borne diseases, and drug and insecticide resistance. Finally, let me conclude by highlighting the relevance that the health track of the G7 is conferring to the involvement of the engagement groups, international and non-governmental organizations, and civil society in general. Let me conclude by acknowledging some of the support we regularly receive for health-related issues. Our collaboration with the Ministry of Foreign Affairs and the Ministry of Finances play a vital role in the overall impact of our action. Health has to be considered an investment. And through our collaborative efforts, we can make it a priority on the global leaders' agenda. I thank you all for your attention, and I remain available for potential questions.
Many thanks. I just received a question from Marwin Mayer from the World Vision Germany. I must say, this question is intriguing, also because we raise it during our interview that we use for drafting the paper. The question reads as follows. With global warming, malaria seems to creep back into Europe, the global north. Do you think this will be an incentive to spur R&D and invigorate the fight against this pandemic? So let me just continue the list of speakers, and then I will ask if anyone of you would like just to give a brief response to this question. So now the floor goes to Mams Yaffa from Élus locaux contre le paludisme.
Thank you. So I'm Mams Yaffa in France for the Élus locaux against the malaria, donc contre le paludisme, and we work of diaspora stuff in France. So for the African diaspora in France, malaria is a close and distant enemy. A close one because diaspora members through remittance contribute to their family access to health service living in endemic countries. About 8 billion euros sent each year from France to African countries through remittance. These are essential economic contributions, in particular in African francophone. And while difficult to evaluate, it is considered that a large proportion of those funds are used for access of ill care. A distant enemy because every African diaspora member is aware of malaria. Often the prevention is weak, which leads to many imported malaria cases. In 2023, alone, 508,000 cases of imported malaria were recorded in hexagonal France, with over 95% coming from people coming back from Francophone Africa. Even all of these aren't African diaspora, they are in the front line. What kind of work we do with it? Our work is to mobilize the African diaspora, like at Esprit de Ben, and how I led to the event mobilizing the diaspora head of the Global Fund replenishment and the local representative decision to create an entity, local representative against malaria, to amplify campaign and prevention, but also advocate for increasing funding against malaria. Today, we have launched the campaign Team Zero Palu, Team Zero Malaria, gathering artists, athletes, malaria researchers and nurses, and political figures who cannot accept anymore the death of a child every minute. This will be both a grassroots campaign with civil society and the activities between April and September to get people to learn about malaria and its devastating impact, and a political advocacy campaign with the engagement of French authorities to request continuous and increased investment in malaria. We will be active across the Olympics and Paralympics Games to galvanize the energy and solidarity and prepare for successful replenishment of the Global Health Initiative that are supporting the fight against malaria, such as the Global Fund, Gavi, and United. We need to be the generation that can end malaria, and to do that, we need all of you. Malaria won't stop without you. Thanks, everybody.
Many, many thanks. Now, last but not least, the floor goes to Linette Kenelway.
It's okay. Don't worry.
Sorry for. I hope I went just close to the right pronunciation. Please go.
Don't worry about it. That's what happens when you get married and you can't decide on a surname. So you include everything, but you don't know what to remove. Just to say yes. Thank you very much for having me at this panel. I really do thank all the colleagues, the friends, as well as you esteemed leaders, all protocols observed. It really is an honor to speak at this wonderful event, and congratulations on the brilliant paper that you've produced around malaria, and actually highlighting the spotlight of how critical it is that we really need to look at malaria again, not through a vector approach or not through kind of like a siloed approach, but to really have a look at it and where it belongs. I think we have situated it. So congratulations to all of you for doing that work. So my name is Lynette Gileilwe Ntimkulu Aide. Very long. I will try to shorten it at some point. I'm a global health advocate, and I am speaking on behalf of the C7 Global Health Working Group. I am also a board member on the UNITAID board representing NGOs. So colleagues have spoken across the board. We've heard a lot from esteemed academics. We've heard from thought leaders. We've heard from experts, as well as from multilateral, multinational donors and colleagues who have worked on this paper, but who've also contributed so far in the malaria response. We do know that we're facing malaria, and malaria resistance is definitely increasing in a lot of, LMICs looking at Africa, looking at, Southeast Asia, as well as Latin America. And there's a lot of work that's going on, right? There's a lot of scientific progress, so there's a lot of R&D that's going on. We are now seeing that we've got the 2 vaccines. We're very excited that we're looking at, the NETs projects that's currently being funded by UNITAID Global Fund, as well as the Vaccine Alliance. But it's now for us to ask ourselves, how are we going to get back from where we left off? Because malaria and everything else requires a graduated response. When I was talking about where we can situate malaria, I was talking about the fact that at least malaria has a place in AMR, but malaria is not in AMR conversations. As a person representing civil society, it's a shrinking space for civil society to be part of these conversations more and more. And malaria in AMR is not there. I sit on various bodies where we discuss a lot about AMR, new tools, what we have in the kitty, what we're going to do, but malaria is not one of those. MDR-TB is in there, malaria is not in there. Malaria resistance is now emerging at a very fast pace. So it now at least has a place. The question we need to ask ourselves all in the room is, how do we then situate it into the AMR conversation? How do we push it? Even the pandemic accord, I don't think will recognize malaria as a pandemic, even though it is. So we need to, again, do that socialization, and that is where civil society and communities come in. I also wanted to just mention the wonderful work that all of you have done actually in the past to make sure that there is decentralization of malaria, and that civil society and has work that actually does the household approach, where we actually go from house to house. And for instance, Dr. Birungi doesn't have to worry anymore about siblings dying or children dying because we're missing a house. Now, this will require, of course, the first thing, which is then the box, which has got all the diagnostic tools that we need in each house. That'll be brilliant across the board, because it's not only a southern issue anymore, it's also a northern issue, as the question was posed, right? So if we're facing something like this, if we're facing biological warfare, we cannot take different sides. Secondly, I think politicians or leaders need to actually sit down and talk about what happened during COVID-19, because I think those wounds were never healed. All we ever do, it seems, is that we move from one problem to another. We don't actually take time to reflect. And it is through reflection that I think we are able to contribute better to what we need to do. I come to you now with what we can bring in as civil society. So the reason why we actually, I think, have this new NETS project is because we were facing a situation of square nets in round huts. It was not working. So whatever was brought to people to save, LMICs was not what LMICs required. So that rhetoric is now changing. We need to now ask ourselves, how do we continue that rhetoric? And that is work that we are happy to do with colleagues across the board. Congratulations to colleagues such as, Alma, Gavi, and Global Fund for funding community-led monitoring, where we're getting civil society not only focusing on vector control, but doing actually collection of data to find out what are some of the systemic problems that people face in their homes that causes them not necessarily to access services. And through this, for instance, in Nigeria, they found that some of the problems were that when people visited, especially pregnant women, when they visited healthcare facilities, they needed an ablution separate from the one that is shared by all. If a private philanthropist came through and built something. So clearly there is a lot of effort that can be, a lot of work that can be done at a domestic level through working through a private public partnership. So I don't think, Pete Barker, you should feel very bad about what is going to be happening from the South up. As you've heard from the three colleagues before me, there is a lot of political push, because clearly there's no will, but there is a lot of political push, legislative push, political push to ensure that we actually are starting to see what countries themselves and LMIC countries can do in order to shift this needle. I'm just going to take 2 more minutes just to get through a few of the points that I wanted to mention. Now that we're looking at malaria through the fresh eye, 1 minute. Okay. Now that we're looking at malaria through the fresh eye, I think a syndemic approach is definitely required across the board. We see that TB is a priority, malaria is a priority, this is a priority. Syndemic approach could perhaps assist us in looking at how do we look at these collaborations through global partners. Secondly, can we look at human-centered design to see how we can leverage human-centered approaches for us to have better surveillance? Number one, as I said, through communities doing CLM, that will help us with routine data collection, as well as looking at what is acceptable at community level to increase what is happening and how we actually get or respond quicker to problems that we face at a domestic level. I think we'll do a lot of great work, and I just wanted to say congratulations for the report for this meeting and the fact that the G20 are also very much interested in the agenda, and that the report will also proceed and go there. So congratulations to you all, and we look forward to working with you as equal partners at the table as we actually eliminate malaria. Thank you.
Thanks a lot. First of all, I would like to ask you if is there anyone who volunteers to respond to this question related to the risk of enlargement of the disease to the global north. You want to?
I want to touch this very shortly because I tell you that because I worked with HIV for years, the reason why such an incredible movement to fight HIV was born is because we saw the disease, okay? So the risk of having it again may work. But I just, 2 seconds, we were talking about pricing of costs of vaccines and drugs. Are we talking with medicines patent pool, for example? Because the example of HIV/AIDS is very important. We couldn't save millions of lives without the decreasing prices of the antiretrovirals that now cost $30 per year per person, 30. And I don't know if you know how much it costs here or in the north, in the global north. So I was wondering if for drugs or vaccines, we could negotiate a patent, a voluntary patent because I'm actually also working for Medicines Patent Pool and the UNITAID. And so in a sense, this model that HIV did, I think it could be used also for malaria tools.
Thanks. Any other very short comments? Yeah, please.
I'm director of Italian Malaria Network. Concerning the mosquitoes, I mean, the only thing is monitoring and surveillance. Personally, I would be more afraid about dengue because the Aedes mosquito are more easily and rapidly adapting to climate change. If I can, this is a point because before we were talking about, for example, Burkina Faso. I'm collaborating with Burkina Faso since year. This year, there was the most dramatic dengue epidemics in Burkina Faso. So when we talk with malaria, we should have a wide view. And so monitoring surveillance, for example, of the vector could be useful for malaria, but also for other vector-borne diseases. And this should be taken in consideration because this is, I think, is a critical point.
So many thanks. Before giving the floor to Ambassador Giungi for a couple of final remarks, let me just say a couple of points which are very important. First of all, on the research side, but also this regards the public discussion. I think this debate has made it clear that there are some issues that need to be explored and discuss further. And this includes certainly the problem of the effects of COVID-19, which probably have been very large, even larger than we expected, and lessons that we can draw from this experience also for the fight against other pandemics. Second, I would emphasize again the issue of nexus between climate change and health. We receive different views and also some different perspective during our interviews. So clearly, this is an issue that needs to be discussed even further, and on the basis, of course, of the evidence that will become progressively available. And the third point I would emphasize is also this problem of diaspora that we do not address in, I think, if I remember well, in our paper, but can become a challenging issue. It's clear to me that we have several very strong, I would say, compelling arguments in favor of for insisting, for reiterating this need that the fight against malaria receives a solid support from public institutions, government, international institutions. We have a moral argument, of course, given the number of deaths and the size also of communities and areas that are affected. And in fact, the data projected in the coming years are very impressive. We have a strong economic argument. We know that the impact of malaria on the prospect of economic development is huge. We have a third strong argument related to the effectiveness of the new instruments. So investing in those instruments and tools would be extremely important, but also very productive. And we have heard also the complaints about a situation where it's impossible in many cases to use them because of course of the cost and lack of resources. And also I would add a strategic argument, because this is an issue that should be tackled, that can even help the G7 and our government to advance also this effort to increase and deepen the outreach to the so-called Global South. That said, of course, we cannot, and this is a point that has been made very strongly, ignore the context, and the context is a context of fiscal constraints, competing priorities. Clearly, we know that in the case of malaria, there is a mix of possible interventions. There are daunting trade-offs, competing strategies. So this calls, of course, for new instruments, programs that allow the main actors to monitor, control the impact of those individual measures. We know in the specific area, considering the specificity of the different countries and areas. So an effort in this sense should be made. A third, finally, of course, the synergies between the different actors. They have all of them a special role to play, but of course, as many of you have emphasized, there continue to be the need to create new mechanisms of coordination and also way of having joint efforts to achieve the most important goals in this fight against malaria. So thanks a lot again, but I now give the floor to the ambassador for some short final remarks.
Well, thank you. Yes, in the end, well, Director, you said it all, actually. At least we could have compared notes, maybe. But yes, what astonished me is the degree of unanimity I saw in the interventions by the panelists and in the presentation of the study. All voices voiced quite clearly the same concerns and the same hopes, I would say. The first concern, you said it, resources, competition for resources, I would say, because as we all said, we are facing a multidimensional crisis which affect the same crisis affect different areas, different actors. And given resources means that the slice gets thinner and thinner. The possible solutions, optimizations of the use of resources, which means coordination among all actors, but also a clear prioritization by the countries affected. And a clear prioritization means also a focus on domestic resources. Vaccines, bed nets of second generations are progress which we rely on. We are all aware we need a cocktail of a mix of interventions, that each measure is necessary, none taken by itself is sufficient. But also I saw a clear optimism, because we have also some very good examples, like Capo Verde, like Vietnam. So it can be done. It actually can be done. I don't know whether malaria will spread to the north of Europe or to the north of the world. I hope that given these circumstances and this very clear unanimity in keeping it a priority for the international arena, I hope it won't be needed in order to keep on trying to do our best to fight this scourge. Thank you very much.
Many thanks, Ambassador. Again, many thanks to the friends of Global Funds Europe for their encouragement, support, and cooperation, and all of you for being with us today. It was been, I think, a insightful, very lively and rich discussion. We'll continue to be committed to furthering with your support, and we hope we keep in touch. Many thanks again.